You're listening to Transformation at Work, your one-stop guide to Salesforce success. And this is Salesforce Tech Talks, comprehensive deep dives into the art of solutioning and implementation for Salesforce. Our expert squad of developers, solution architects, and industry veterans are breaking open the black box and digging into the possibilities of solution design and architecture. The show is brought to you by Jarrett, a summit-level Salesforce consulting and implementation partner and solutions provider, and I am Jeff Stormer, your host as always. It's a new year, and that means that healthcare payers, like just about every other industry, are looking ahead to the 2024 trends that are likely to impact their business. Now, it would be easy for me to sit on here and start this episode with something like, there are massive, sweeping changes on the horizon that are threatening to turn the healthcare payer space on its head. New technology, legislative changes, and the overwhelming shadow of AI are disrupting the sector left, right, and center, and here's what you need to do to be ready for it. But to any industry leader that's been really paying attention, you probably know that that's not necessarily the case. Yes, there are trends to watch in 2024, and yes, they are going to have a considerable impact on how payers do their business. But as Cheryl Gibson, Jarrett's Senior Director of Healthcare and Life Sciences for Payers, pointed out when we sat down together,
some of these will not be a surprise to the audience. Some of these have been looked at before and continue to be on point, but I think they're important to mention.
Which means that the big question that payers need to consider changes a little bit. It's not what big trend is coming in 2024 that's going to turn the industry on its head, but rather, it's how can healthcare payers address some of the rising and growing trends that have been developing over the last 6 months, a year, 2 years, that are going to continue to become more and more prominent as we head into 2024. And how can Salesforce help those payers automate processes, meet the customers where they are, and get ahead of those steadily developing trends? And that is exactly what we sat down with Cheryl to discuss today. Cheryl, of course, brings nearly 3 decades of experience in the conversation, the last 10 of which were spent specifically overseeing strategy, design, and implementation of complex projects in the Salesforce ecosystem for some of the largest payers in existence, which really makes her the perfect person to discuss this with because she's seen how the healthcare industry reacts to these steadily developing trends time and time again. Now, as for the question of what those developing trends are and what topics payers should be if they aren't already watching out for, here's what Cheryl had to say.
One is the elevation of the member experience, and not only from an engagement and member retention standpoint, which of course is critical, but to also identify interventions and community resources to help assist those members. Secondly, the automation of prior authorization continues to be of critical importance. And, as pressure continues to mount for payers and providers, we have to improve this process. And speaking of providers, payers are looking to drive better outcomes for their members through things like value-based arrangements with their providers. And then lastly, and I think this is an important one to bring out, community partnerships are key to payers because they help them to service their members in a more holistic manner. And again, as I said, while these trends are not new, I would say the level of engagement has definitely heightened.
So I'd love to dig a little bit deeper into each of these, right? To really talk about how payers can get ahead of some of these trends and what steps they can be taking to address these issues if they haven't already. Starting where you started with that member experience piece, talk to me a little bit about how payers can leverage Salesforce to really meaningfully give that best-in-class experience to their members.
Yeah, I think, there's a couple ways that we can assist payers utilizing Salesforce. And, one is to have a payer-designed approach to a contact center where we can work with the payer to build upon these critical areas and improve outcomes. One thing that payers do just historically, we talked about them not being at the forefront from an industry perspective or a technology perspective. So they have a lot of homegrown systems, a lot of databases and data warehouses kind of holding things together. And in order to really improve the member experience and take things to the next level, they're looking at things like data lake or data cloud in the situation of Salesforce, and ways to bring all their member information in a way that's consumable and actionable. And that kind of thing does not, take place overnight because you have data spread out amongst all these different platforms, which takes to the second point about key integrations with the payer platforms can be leveraged, right, to socialize details from both the claims and care management platforms. Payers have so much detail and so much data at their fingertips, but sometimes they're not using it in the most cohesive manner. And then the other piece is, things like survey results, which include social determinants of health, which can be orchestrated to foster more community level intervention and address unmet social needs. And this information can be shared with the provider to improve the member's care. A lot of times, even though payers have all this information as they capture maybe with health risk assessments, that information isn't always passed on to the physician. And it could be a situation where a member doesn't have access to a car. They're unable to go pick up their prescriptions. And when you're able to capture that level of granularity with a member and be able to share that with the provider, then you're really getting at trying to help that member holistically.
Now, moving on to that prior authorization piece, and I get the sense, maybe this is the understatement of the year, but this is probably a larger lift, right? I know it's something that we've discussed before, but are there lower level lifts, low hanging fruit that payers can take advantage of to help streamline that process so that members and their providers can really fast track that experience to get the support and procedures that they need on the table quickly?
I think a lot of people think of automating prior authorization as an elephant, right? It can be overwhelming, or to use the term, boiling the ocean. And with anything of this magnitude, you really just have to start small. And so a few things that payers could do, we know that this is primarily a manual process with a lot of payers where providers are submitting these authorizations through fax, email, calling them in. And being able to utilize Health Cloud, we can work with payers on the automation, of this manual process. And part of it is we understand the pain points and the necessary steps that need to be taken and to really help to execute this critical area of functionality. And we can work with payers on integrations. If they want to still use their own utilization management platform and just integrate with Salesforce, that is definitely an option and could be an iterative way of getting there. And they also could entirely build the process within Health Cloud. Another thing to leverage are things like provider portals. And payers can allow providers to submit their authorizations through the portal. So that is another way of just starting fresh. Again, trying to change behavior on the provider side. Both MCG, which is formerly known as Milliman, and Interqual can be included with this process. And both of those organizations really help to guide payers and providers as it relates to medical guidelines. And then lastly, the payer can begin paving the way for automatic approvals for authorizations meeting the appropriate criteria. And I think that's where really the payers want to get to. But a lot of that is, looking at their data and historical information to be able to build that logic in the system. So that is definitely something to aspire to, probably not something to be done day one.
Sure. That's a bit more of like the substantial improvement, but I think that's also something that, to our previous conversations is something that, the amount of time and dissatisfaction that that's going to avert, I think is pretty significant. Would you agree with that?
It is significant. I have, friends and family that because they know I have a payer background, they'll ask me questions about authorizations, why things take so long, why is it a situation where you're sitting at the provider's office waiting for what you would consider a critical procedure and waiting to hear, is it going to get paid? Or are you going to be out thousands of dollars because the health insurance company isn't going to pay for it? And, when I get asked these questions, of course, I know the background that, well, did the provider send all the information that's needed? Maybe that's where the breakdown in communication, but really this is something that touches the member so closely. And, a lot of times some of these particular tests can be the difference between knowing if you have cancer or not. It just is very emotional with these tests, and being able to articulate through the process, make it as streamlined as possible for the provider and payer, but not having the member in the middle is key.
Now, moving on to partner organizations, right? You mentioned how important it is for healthcare payers to have these really strong relationships with sort of outside organizations, community care groups, and the like. What can Salesforce offer healthcare payers in terms of establishing, building, and really maintaining these relationships with outside organizations over time, and also to leverage those partnerships when they need them?
Yeah, Jeff, good question. And, there's a lot of things that can be done. So here are just a couple examples, but, we can work with payers to configure detailed health assessments, because first you have to find out what's going on with your member. And a lot of times payers do that through health risk assessments, through conversations between the nurses in their care management area and the member, understanding, what kind of ongoing conditions they have. Are there barriers to care, like what we talked about earlier? Is the member able to get their prescription? Are they able to secure a ride to their provider? And if any other type of social factors, such as food insecurity, all of those can be uncovered through a health assessment. And bringing this level of detail into Health Cloud can really provide thoughtful engagement with that member, both from a member service perspective, but also to drive that needed engagement from the care management team. A network of community relationships can be gathered in Salesforce to easily provide necessary details to members in need and help secure those necessary resources. So those are kind of some examples from a community perspective. But let's also talk about relationships with their providers. So, a lot of the key to a lot of payers attracting members is the breadth of their provider network. Let's face it, that one of the first things you look at when you're moving to a health insurance company is my doctor in the network? And so Health Cloud can be utilized, first of all, from a provider network management standpoint, to, just manage that network from an administration, a recruitment, credentialing those providers, taking them all the way to contracting, which of course leads you to onboarding those providers. There's always a lot of training that those providers have to go through. And then what I would call more maintenance, meaning self-service capabilities for those providers, being able to equip them with the ability to view claims, authorizations, patient level detail. And we can work with payers to take a focused approach to every aspect of this journey with their providers. And again, all the way from recruitment to ongoing maintenance with those provider relationships. And working with the payer on their pain points in this area, we can prepare a roadmap to really help them end to end in this process.
Now, as is true of every other year before this, one of the major issues that healthcare payers are going to have to face in 2024 is the ongoing issue of regulatory and legislative change. The reality is these simply aren't going anywhere. Here's what Cheryl had to say about how payers can not only address potential changes coming in the short term, but be ready to pivot in the event of future changes coming down the pipeline, rather than reacting to each individual change in a very piecemeal fashion. Let's throw it to Cheryl.
And wouldn't it be nice, Jeff, if we had a crystal ball and we could look at what's coming? And so, I thought long and hard about, this question. And I think, what I've seen from the regulation perspective over the years they're typically around what is best for the member, improving manual processes that in the past have negatively impacted the members. We talked about prior authorizations being an excellent example. Some past examples also have been driven by legislation are things like cost transparency, being able for members to go out and if they have an upcoming procedure, being able to view how much is this going to cost me from a copay and cost share perspective, the gathering of consumer preferences. So things that are important to the member, whether how to be communicated with, email, phone, text, etc. And then, also the No Surprises Act, which was something that came out a few years ago, related to balance billing, that when a member, no fault of their own, it is typically a situation of an emergency where out-of-network providers would participate in their care, and then they would get a surprise bill from an out-of-network provider that would be an incredible amount of money that they owed. So if you just take those three as examples, historical legislation, you can see really where the heart of that, legislation is coming from. And so if you think about it in that perspective, if you build your process around the member experience and really have those effective relationships with community leaders as well as providers, chances are you're going to have a leg up at least on items surfacing in the future. And, just being able to assist in that area. And also, I would say the last thing I would say in that particular question is having a platform that will grow with you. And that is something like Salesforce.
But Jeff, what about AI? We've got to talk about AI. Heard, Chef. Let's get into it. Every industry under the sun is being impacted by AI in some capacity or another. But as Cheryl notes here, the interesting thing is how relatively reticent the payer industry has been in adopting AI into their workflows, and the very specific things that would need to happen for payers to embrace that technology. For a deeper look at that, here's Cheryl.
Not surprisingly, we're seeing AI consistently in industry articles, but I can tell you that the payer industry is really treading very cautiously in this area. The healthcare industry is very human-centric, and it's critical that we use AI judiciously.
I'm wondering if you could say a little bit more about why that is. Because like you said, we hear that in every sense, right? We've heard every industry react to AI in certain ways. And you would think in an industry as regulated and as sort of judiciously watched over as sort of the healthcare payer space, we would see more of that AI in action. What is, in your estimation, one of the big reasons why that space has been sort of so cautiously approached in the last year or so?
Yeah, I think it's because, folks, particularly in the payer industry, they're very much of a wait and see kind of industry. They want to have other industries try things out, learn about what to do, what not to do. They're not typically leading the pack in terms of industry. They're more followers. And I think, just one article that I read recently in which a very large payer, I won't mention their name, was called out in an article for utilizing AI, and it ended up denying a lot of claims incorrectly for members. And so I think the more you see some articles like that, you have other payers kind of sit back and watch and just say, okay, let's try this out very cautiously for things like, just from a provider perspective, I've seen things being used where, they're able to transcript their notes or be able to become more organized, have more time to spend with patients. Those are things that definitely, I think, are low-hanging fruit and would be helpful. When it comes to AI kind of leading the charge for prior authorizations, I think some payer organizations are looking into that. Again, I think they're going to step into it very cautiously just because of the sensitivity that the payer industry is very, very much in a microscope in a lot of ways. And I think that also lends to them being cautious about things, because anything that's done that affects how a member, their health is being addressed, claims are being paid, et cetera, obviously draws attention, within the world we live in. So I think those are just some reasons why they're being a little bit more cautious in that space.
Now, understanding all of these trends and how they're the natural outgrowth of industry developments that we've seen over the past few years is great. However, you may be asking yourself, what do I need to do right now? When we raised that question to Cheryl and asked what can health payers do in the short term to really get ahead of these big developing 2024 trends, here's what she had to say.
First would be to prepare a thoughtful roadmap and look at every area that touches your member. Now, I say that lightly, but this can be days to weeks to put this together. So it's not simple, but it's a very, very good exercise to map out the current process and really have all stakeholders in a room, and have a mapping exercise. And it's always important to start with, here's the current process as we know it. How do you want that process to look, future state? And don't think about the platform. Think about it from a system agnostic perspective. If you could design what the process would look like that would accomplish what you're looking to accomplish, which is ensuring that the member is in the center of every process, then you design the system based on the to-be process. And, again, kind of to use some of our phrases from earlier, you just try not to boil the ocean, but look at it from a perspective of where do we want to start? And we always encourage payers to start with customer service, right? Start internal and move outward. Move outward to your providers, your members, your brokers, but start kind of with that hub of customer service or member services, as they call it. And so start small and iterate. That's what we would encourage folks to do. A lot of times companies will not move forward with projects because they just feel overwhelmed. So, I think that's why it's good to have this road mapping exercise to think about, where do I want to be in 5 years? And then what are the steps to get me there? And then each milestone to get you there, just focus on that. And the important thing about doing a roadmap versus doing things in isolation is that if you know where you want to be in 5 years, then everything you build in those, intricate milestones or those phases, everything is going to be built to be able to scale to what you're looking for in 5 years. So that's why I can't emphasize enough the importance of really taking some time to do that thoughtful roadmap.
It's easy to imagine, especially in the tech world, that a new year is going to bring 1,000 groundbreaking developments that flip our world on its head and change everything forever. But the reality is, especially in the healthcare payer space, the big trends in 2024 are the logical progression of the big trends out of 2023 and 2022, and that the big issues that payers have been dealing with, well, they're going to continue to deal with them. The really nice thing about that is that for payers who have been keeping informed and paying attention, or are working with technology partners who have studied and analyzed these trends, is that you've seen a lot of them develop over time and can trace that trajectory to where it's likely to head in the new year. That, alongside the right technology that can help make adapting to these trends easier and seamless, is really what any healthcare payer needs to make 2024 the most successful year that it can be. And that is transformation at work. This has been Transformation at Work. Thank you so much for listening, and thank you once again to Cheryl Gibson for some truly wonderful insights and conversation. Transformation at Work is, as always, produced by Jarrett in collaboration with Salesforce. I am Jeff Stormer, your host and producer. If you enjoyed the show, consider leaving us a 5-star review on iTunes or Spotify, or head to jarrett.com to sign up for email updates when we release new episodes. Until next time, thank you again for listening, and we hope to see you again soon.